I saw this story a couple of days ago and thought, in a way, it's surprising. In another way, it's concerning. So here's the deal. A new poll shows that more than a third of Canadians, more than a third, feel they have no choice but to seek health information online, so much so that we've actually coined the term Dr. Google, right? Trying to diagnose something by going online, simply because they don't have access to a doctor. So this is obvious. Just, right off the top, the idea that you're going and taking information that you would find online instead of the fact or being able to go to a doctor or a family practitioner of any kind, a nurse, whoever, is in itself troubling. So it gets worse because it turns out if you go and follow the information you got online and assume that it's just true, which is a huge assumption, when it comes to your health, that's not necessarily a very good idea. And we're finding out from the study as well that too many people end up taking that advice and then, well, it doesn't turn out the way they'd expect it to. Things can actually get worse. So we have to try to understand why this is happening and how it can change. Dr. Josh Reimer is president of the Canadian Medical Association and on the line. Dr. Reimer, thanks for being here.
Thanks so much for having me.
I would simply, right off the top, as I said, when you talk about something like this, I don't know, maybe at the outset when you could start getting this kind of advice, it was almost a bit of a, I want to say it was just kind of cute that you could go online, not have to bother somebody. And now, sadly, because in this country, we know we're short so many doctors, far too many people are getting their advice here. Why is it worrisome?
Well, just like you said, of all the things we saw in that survey, the stat that you talked about where people were 37% saying they don't have access to a doctor, so they don't have another choice, that's a big part of the problem. Not having access to a family doctor is a reality for 6.5 million Canadians. And so it makes sense that they're going to go and try to get information somewhere else. And some information online is good and helpful, but the problem that we see is that particularly with social media, misinformation is getting forced on us. The algorithms push that misinformation towards us, whether we're looking for it or not, and that's where we're really seeing the harms. 23% of Canadians have had a negative health reaction from following online health advice, and that's a big problem because that's just the people who are admitting it or are recognizing that that's what happened. And all of us physicians have stories about harms that we've seen because of these situations.
It's interesting. We know the term algorithm, but never thought of it in the sense of advice you're getting from the internet. So how would that work necessarily? You look up at something that happened, you have a condition. What's that algorithm telling you based on what?
Well, there's a few different ways that this can happen. So when you're Googling something, then Google has different ways that it decides what goes to the top of that response list. What's on page one, what's number one. And that really depends on how popular different answers are and how different websites are valued by Google. They don't share their exact algorithm, so there's no way to know exactly how they choose what goes number one. But where we're also really worried is there are, especially with the younger folks, a lot of people are getting health advice on social media. So they're on TikTok, they're looking at Reels on Instagram, they're on Facebook, other social media sites. And there, when you're just flipping through, just usually for more entertainment purposes, looking from one video to the next, you don't get to choose what the next video is.
Right.
The social media platform chooses for you what video is coming next based on what it thinks that you want to see. And that's where we see misinformation being pushed. And in fact, on Facebook, we've seen that misinformation gets 6 to 10 times more engagement than factual news. And that is a big problem. And these companies are profiting off of the misinformation that's harming Canadians.
Yeah. Again, I don't know how the profit motive works in something like this, unless they're trying to sell you something that's a drug that could help you with whatever it is your alleged problem is. But if I go back to why this is happening in the first place, as we said just off the top, with so many Canadians simply unable to find a family doctor, and you point out, or it's pointed out in the article, that it turns out the number of job openings for general practitioners and family physicians here is basically almost twice as many people that you're looking to get into this particular field as there are people who will get into this field. Why is that happening?
Well, and that's just the job advertisements. We know that the job openings are far higher than that. So we have a lot of things happening at the same time. So one was, we all know about COVID that caused a lot of burnout. A lot of physicians have decreased hours or left the profession just because of how hard things were. But this happened long before COVID. And so there's two things that happened that really created the situation we have today. One is just simple demographics. Our population is aging, got a lot of baby boomers, and their health is starting to get more complex. So when you have this big group of people who have more complex health needs, there's more demand on the system. And then at the same time, our physicians are also getting older. So we have a big group who are retiring, near retirement. They're also the baby boomers who are now switching from being health providers to health users in the system. And then also in the 1990s, there was this belief we had too many doctors. And so we decreased our class sizes across the country. And so those people who are at the peak of their career, mid-career, would have the most patients. We have a much smaller group of those doctors. We're trying to fix that. We've got increased class sizes that we're starting to see across the country. But when a family doctor has 10 years of university education, that's not going to be a quick fix.
Well, we've laid out everything that's wrong in the system and all these terrible results that, are happening because of it. How does this change? Obviously, the federal government is aware of this, right? And, by the way, I should point out, we spend so much time, I'm in Montreal. We spend so much time talking about the healthcare system here. We forget the rest of the country apparently is not doing a whole lot better than we are. So what's the solution here?
Well, we need to be doing two things at the same time. So we need to be fighting the misinformation. And that's why the Canadian Medical Association, we are funding health journalism because we want to see a healthy media ecosystem as the backdrop on all this. And we also need to have physicians and trusted sources in social media where people already are. And so we have a Healthcare for Real platform or channel that's on Instagram, it's on YouTube, and that's somewhere people can get trusted information about the healthcare system. And we're also supporting physicians who are present on social media so they have the tools to be there to give accurate information. Then also, we need to fix the access problem. And like I said, increasing class sizes, that's absolutely something we have to do, but that's going to be 5-10 years in the future before we see big changes there. So we want to see team-based care, especially in primary care, where the nurse practitioner, the pharmacist, the social worker, they're all working on the same team with the family doctor in the same space, sharing a health record, so that we can take more patients in, where we can use our different expertise and training to provide the best care to patients when we don't have enough family doctors, and decreasing the administrative burden, because our family doctors spend 10 to 19 hours a week on paperwork. And so getting rid of some of those forms, and especially getting rid of sick notes, we write 12 million sick notes a year in Canada. Getting rid of some of those things can make a big difference to the time those doctors have available to patients. Yeah,
so you're laying out a perfect scenario, if you would, for things to have to happen. But you're right, they don't change overnight. I'm just wondering, with respect to one other issue here, and I'm wondering if this is Canada-wide as well, why are fewer and fewer students who become medical students choose not to go into family medicine?
Family medicine is a tough gig right now. We see a lot, especially the younger ones, the new grads, they don't really want to run their own businesses. And most Canadians probably don't realize that most family docs, they run that office. They have to hire all the staff, they pay the utilities, they pay the rent. And that's a tough job, especially when we're not trained with any business background. And so we're seeing that with the increasing complexity of the patients, with the they pay 40% of their income goes to overhead. It's a tough job, and they also aren't feeling that satisfaction because they know they aren't meeting the needs of Canadians. So you go to work, it's a big slog, and there's so many people that you can't care for. So I think a lot of people are looking towards specialties that pay better, specialties where they don't have to run the business, they don't have to hire all the staff. So we need to support the physicians. We need to create these teams. Would be a great step in the right direction, so that it's not just a doctor by themselves trying to be everything to everyone, and instead we can work together to support each other and support our patients.
Have you seen anyone doing this right? You talk about best practices as you look around the rest of the world. Has someone doing this? Is someone doing this a better way than we are?
Well, even within Canada, I don't even have to go to the rest of the world. We have great examples of clinics that are working really well. And most provinces have some examples where they piloted things. I visited a clinic in Halifax that was doing a great job. I worked in a clinic in Winnipeg where we had a social worker, occupational therapist, physio, pharmacist, 2 nurses, a dietitian. It was a wonderful environment where the physicians got to work together with that whole team to provide care. So we know it works, and we know we can learn from each other. The question now is, can we get the government to invest in this so that it's more than just pilot projects and becomes the norm?
I would ask you one last thing because I have to wrap up here. When we started the conversation about people going to Dr. Google, and you mentioned that the Canadian Medical Association is able to provide obviously better advice, what's the recommendation to someone who does not have a family physician, wants to go online and find some information? Where should they go?
Well, go to a trusted source of information. Go somewhere where they're not trying to sell you something, but they've got your best interest in mind. So if you want information about diabetes, go to Diabetes Canada. or the Public Health Agency of Canada, or Health Canada, or if you're pregnant, Pregnancy and You is a great website from the Society of Obstetricians and Gynecologists of Canada. These are the types of places where, the information, it's not going to be perfectly tailored to you. It's not the same as having that trusted relationship with a health expert, but it is at least information that has been vetted and put together to try to help you through those health decisions.
All right. Dr. Reimer, we have to leave it there. Thank you so much for your time.
Oh, I really appreciate the opportunity. Thank you.